Hello?
Hello, ma'am. Good afternoon.
Can you hear me?
Yeah, I can hear you. Can you hear me?
I can't hear you. Hold on.
Yeah.
I think it might be my device. This is like the second time I've had this problem with this one.
Mm-hmm.
Let's see. It's the audio isn't working when someone is over Zoom. So who knows? How are you doing today?
I'm great. How are you doing, ma'am? Good afternoon.
Good. Well, yeah, it's afternoon here, but it's night there, right?
Yeah, it is.
Well, thank you for accommodating me.
Thank you for giving us your time, ma'am. I know you must be very busy.
Well, never too busy to talk about something that I enjoy and something that I love. So
before we begin, I am Dr. Prithvi. I am a fresh medical graduate and a medical practitioner in the city of Mumbai, and I am a member at Youth Cancer Action India, which is a non-profit charitable organization that is dedicated to improving the health of cancer patients and survivors in India. And before
wow.
we begin, for our viewers, let me introduce you. Mrs. Tanja Thompson is just, where do I begin? A decorated US Air Force veteran, a two-time breast cancer survivor, founder and CEO at Breast Cancer Move Foundation, and the author of this amazing book, What to Expect When You're Not Expecting Breast Cancer. A tremendous orator, ma'am, a tremendous, and the list is endless and incredible. Thank you for joining us today.
Thank you.
So I'd like to begin by asking about the first diagnosis. What were the symptoms that took you to the doctor first, and when was this?
So my first diagnosis was actually in 2005, and I was active duty at the time. And anyone that knows, if you're a mom, you are a professional, you are in school, doesn't matter. One thing you don't have time for is going to the doctor, right? So a lot of times we procrastinate about going. But what happened is that the pain in my left breast was it was tender, and I breastfed both of my sons. So it felt like I was manually expressing milk. But that isn't the reason I went. I went because I was tired. And it just seems like no matter how many vitamins I was taking, it still was not getting any better. I went to the doctor, and what's so ironic about it was, again, as I mentioned, I was active duty, but just 14 months prior to that, I had my baseline. So I was right there at 41, 42 when I went in 2005. So I went in, and she said, and I remember this, she said, well, Miss Thompson, or maybe she said Sergeant Thompson, you just had your baseline. This is probably nothing, but here are some vitamins, but I also want you to go and get another mammogram. Even though you have no history of it, even though it doesn't run in your family, let's just go and get one. And this is what she said, because it's not going to cost us anything. And I went, and the first test, it seems like it was, how you go to a doctor and they're confused about what they're seeing, because and you're a doctor, it's like, okay, this was 14 months ago and this is now. Seems like maybe it's something wrong with the machine. So they had me take another test right then. So I took 2 tests. So imagine, squishing on your,
I know how painful it is.
Yes. And as I was there, and like I said, they did a second test. Now, not no time did I ever think that I had breast cancer. Not at all. So they did the second test. And I think they even had me come in about a week later, because they actually thought that it was maybe the deodorant that I was using, that is what they was actually seeing in the film. So they had me come back a week later, said, don't come in the morning, don't put on any deodorant, don't put on any lotion, nothing. And that one, after that is when things started to happen.
So basically, the breaking of the news for you was long and drawn out. How was that 1 week for you?
Again, so I am my faith in God is very strong, and I don't have the discernment of fear.
Mm-hmm.
So because I didn't have the discernment of fear, even that week, even them calling me back, I put them off. But we even went on spring break because I never had the discernment of fear that it was breast cancer. Again, it didn't run in my family. 2005, I didn't even know anyone with breast cancer. And the one person that I did know, it was her sister, and she died of breast cancer. Now, the news hit me a little different. The actual news hit me a little different. But that time, from the time that I had the 3 mammograms and to the time that I actually heard the news, there was never any fear that it was breast cancer.
So how was the news? How did you take the news?
The news was, Ms. Thompson, we have looked at your film over and over, and you have a fast growing cancer. You have DCIS, and not only is it in one breast, but it has spread to both of your breasts.
So it was ductal carcinoma in situ, and it was in both your breasts.
And it was spread into both of my breasts profusely. She said, we can't even do a lumpectomy because once we do the margins, we are already into another section of where the cancer is. And she said, Ms. Thompson, we have to do a bilateral mastectomy. You know what I said? I said, doctor, how are you telling a 40-some-year-old woman that you're going to take both of her breasts? That was the first thing that came to mind. Again, I also have to preference with, I don't have the discernment of fear because my faith in God is that we come into this world born to die. He is the only one that knows when we're going to die. I did not feel that I was going to die. Now, mind you, my initial thought, and I have to be honest, and I think anyone that hears the news or hears the words that they have cancer, my initial thought was a death sentence. Now, I didn't have the discernment of fear, but the first thing that popped into my mind was that this was a death sentence because I didn't know anyone with breast cancer. So yes.
So how important is, like you said, the discernment of fear and your faith in God? And you've spoken about this before. You've spoken about how your grandma, Willie, had a huge role to play in that. And even your husband, Mr. Philip, he relayed, when the time was. So how did having a very strong and supportive family actually help you, do you think, in the long run?
It helped me immensely. And the reason I say that is, like I mentioned, I don't have a discernment of fear, but I also have to understand that other people are not where I am. So I also have to look at how they will respond to this as well. My husband, Philip, has been with me that time in 28 years of marriage without any break or any thinking that his wife was less than. And because now I'm Air Force, he's Marines.
Ooh, I didn't know this.
Yeah, so Philip is a Marine. So they're used to digging in.
Yes.
And because we are both military, we
Mm.
know that you leave no man behind, and leaving no man, no woman is a term that we know very well in the military.
Yes.
But even with that, my grandmother, before she died, and when we were children, because we stayed with our grandmother for a couple of years, she taught us how to pray.
Mm.
She taught us to memorize a prayer. And she also taught us in any time that we are feeling low or down, depressed, anxiety, pray to God. And praying to God can be, for me, is thank you, Jesus.
Mm.
It's just those two words. So any energy, I believe in connecting into your energy source. Everyone believes in something. It doesn't have to be the same religion, but long as we believe in something, as long as we have something that we are grounded onto, that we can connect with, that we can pull on those days and those times that we are feeling at our lowest. We always have to have something. So my grandmother was that foundation for me. My husband was that pillar, so that on those days and times that I didn't feel that I was my best, he was always there, so I can lean on to that pillar on either side to lean on to. Yes.
How do you think it has affected, not affected, but how do you think it changed the way your children were brought up? Because they also went through something.
Yeah, it's I when you are going through any type of significant emotional event, there are always going to be casualties. And for me, my oldest son was the casualty, in that at the same time that I was going through my breast cancer, our youngest son, who was born at 1 pound and 5 ounces, I'd had him at 23 weeks. His entire life was in the hospital. So there were times that my son, my youngest son, whose name is Tyson Vegas, and I was in the hospital at the same time. So my husband is having to juggle between deciding, who am I going to stay with? Who do I need to take to the doctor? Our oldest son, because he found his brother unconscious one time, as well as seeing his mom go through chemo, where she's this vibrant person who's out running and jogging, to now just sleeping, not doing much of anything. So emotionally, he didn't have the support that he needed so that he could do the things that he needed to just be a child. So we've had to get him counseling as a result of that, and find programs for him so that he could finally be able to understand these things that were happening to his parents and how he could deal with them emotionally.
So after you underwent the surgery, and then obviously there must have been more tests to find out whether the cancer had been dealt with, and that was the first win that you had. Tell me about the second time that this happened, and must have come as a shock.
Yes, and it was a shock for a couple of reasons. So the first one was 2005, and it was a bilateral mastectomy. So as you know, they took everything. So they did just enough to spare the tissue for implants or expanders. So as you know, when you take your skin, you expand the skin, your skin is now very delicate. And exactly 5 years later, now mind you, as I mentioned, bilateral mastectomy, I didn't have to have chemo or radiation the first time. because at that particular time, the practice was that taking the skin, taking the tissue, going into the first set of lymph nodes, and there being no spread of the cancer, that was equivalent to radiation and chemo, because they've taken everything. And anyone that knows have gone through this, nothing is 100%, but they felt that that was at least 90-some% to take care of. So when I found the lump 5 years later, now mind you, my first thought, and when you are connected to a source, when you are connected to an energy, you rely on that as being your guide. So that was my guide. And this is what popped in my head: is not supposed to be there. That was my going theme moving forward. And I'll tell you why that's important. I went to the breast center here at the time. By this time I had retired. So this is 2010. I went to the breast center. The doctor there told me, that's not anything. I don't really even feel a lump. I think that maybe you are over exaggerating. And I said, well, don't you feel this? No, what I feel is where your implants is not, I don't forgot the exact term she used, but she said, implants in your skin on top of it, it gets kind of wrinkled. She said, that's what I feel. And I said, no, it feels like a lump. So she brushed me off. But in my mind, as I mentioned earlier, in my mind, it's not supposed to be there. Exactly. That was the thing for me. It's not supposed to be there, because that's what popped in my head when I first found it. I immediately went to my breast surgeon, who was in the same building. And he happened to be in his office. And he said, Tanja, I did your surgery. He said, let me take a look. So he took a look, he felt both sides. He said, no, that doesn't look like or feel like wrinkling of the implant. He said, because I did your surgery, that's not supposed to be there. We immediately had an MRI, an ultrasound, and an X-ray. The MRI came back inconclusive. Now, mind you, inconclusive can very well mean that there's nothing. Most doctors, and a lot of times, will just say, let's relook at it in 6 months. But he said, I know how you are. You are not going to be happy until it is conclusive one way or the other. He then connected back to the breast center and said, hey, let's do a biopsy. Now, this particular time, they just decided to do a local biopsy where they just pricked the skin. That came back that it was not cancer. But what did I say was the going theme? The going theme in my mind was, it's not supposed to be there. So I said, let's remove it. She's like, there's no need to remove it because it's nothing. It's not supposed to be there. Well, lo and behold, it came back that not only did I have one cancer, but this time I had 2 cancers. So it was DCIS, invasive, as well as HER2 positive, progestin. Estrogen positive. Yeah, estrogen positive as well.
ER positive.
And because it was a reoccurrence, I had to go through surgery, radiation, and chemo.
So I have so many questions for you now. First of all, you mentioned that you and your husband both are from the army, both are from the US Army, right? And so how did that translate into your fight?
I'm Air Force. So I'm Air Force, he's Marines, but we're both in different military organizations.
So how did that translate into your fight in cancer? How did that help you, that training and that discipline?
The training helped me in understanding that in order to, one, not to be in fear. And I'm a type of person, I put things in compartments in my head. So I realized that in order for me to communicate effectively, that I needed to almost have an out-of-body experience in talking to health professions. Because a lot of times health professions, because they are very good at what they do, a lot of times they are not very in tune with the patient. So me being in the health community, the health field, I knew that in order for me to have that understanding, or for them to understand, I needed for them to understand me and my perspective. And being a senior enlisted in the military and having to supervise, having to instruct, having to lead, I knew that I could do this could be done, and we can find a collaborative way to have the best care for the patient, being me.
So this brings me to the next question, which is, how were the doctors that were treating you? How was the team that was treating you? Were they in tune with your needs? Were they supportive? Or what feedback do you have for them?
So I think, so as I go back and I look at that, some were good and some were better than others. The breast center, and you would think that the breast center would be the one that's most in tune, they were the ones that were less in tune. The one that does the biopsy from the first one, he was also a lifesaver as well. So he was very in tune with, instead of just having the right breast biopsied, he looked at the film and said, we need to biopsy both breasts. And come to find out, the left breast was worse off than the right breast. So having a team is paramount, because when we, with the first and the second diagnosis, we met with a team, and they triage, and in that triage, they have the team looks at your records and look at all of the data to come up with the best plan. So that's what happened in both cases for me. Was part of it was inside of the military system, and another part was out, it was external to the military system. But both of those teams were good. It was just little quirks that were in that was not very that was not very, I guess, for all practical purposes, good. Or the outcome could have been worse.
Worse. Right. Tell me about the second battle that you had. The second battle was the more intense one, I feel, because of radio and chemo.
The second one, yes, was definitely, that one was very much of a shock, because I never thought that I would have it for a second time, first of all. But once I wrapped my head around that I had to go through, it was very difficult. And the first thing was that I was going to lose my hair. For women across the world, across the nation, the two things that I tell people, one thing that identifies who we are our boobs and our hair. Those are the two things we do not want to lose. And I'm just going to keep it real with you. Those are the two things that, if anything that's going to devastate us, is going to be those two things. And the second time, I was more concerned with losing my hair. I knew going through chemo, what the result was going to be was that I was going to lose my hair. So vanity, we all have it, right? As I sat with my oncologist to this day, we are still connected, because I still see him once a year, but he made me feel so at ease. Dr. A.J. Dar, made me feel so at his ease. And the reason I say that is that he took time to listen. I was not just a number. I was not just a patient in his office, but I was Tanja, and he would call me by my name, which made me feel that he knew me and he wanted to know how I was doing. And even the times that I had a really hard time, chemo wasn't that bad. I went through chemo pretty unscathed for all practical purposes. But it was the hormone therapy afterwards. I had to be put on probably 4 different hormone therapies. So I'd never even finished out the entire 4 years. Tamoxifen, I had the worst hot flashes. And the more medication they put me on, it did not get any better. So I did that for a couple of years. And then he put me on another one, which made me fall all the time. And he said, and I said, well, this one is fine. He said, yeah, but you're falling. He said, I'm more concerned that you're going to fall and bust your head. I was falling up the steps. I was falling down the steps. But I say that because having a team that you truly trust, having a team that sees you as a person is invaluable. You have to have it. There's no doubt, because if you don't trust your team, if they don't hear you. And one thing my grandmother tell me, she said, Tanja, you have 2 ears and 1 mouth. People need to use them in proportion. So they need to do more of this and less of this. And I've learned that in this journey to ensure that people are doing more of this.
So you mentioned how all women who are breast cancer survivors who undergo this treatment that we're talking about, they deal with an identity crisis when it comes to the treatment, losing their hair, or people who have mastectomies, they will lose their breasts. And so it takes so I personally feel it is a mental battle more. 80% of it is a mental battle, right? So can you hear me?
I think you.
Can you
I
hear me?
didn't get that last part.
Okay. So so it's obvious that the mental aspect is a huge part of the battle. It's a huge part of the treatment, the mental
Yes.
aspect of it. And I remember you mentioning in one of your talks that you were afraid of asking for help even after knowing that you needed help, and it took an intervention for even someone as strong and level-headed as you to admit that you needed help. So how important do you think is asking for help and also getting the right kind of help when it comes to mental health and cancer?
Is paramount, because you are on a journey that you've never been on. No one wants to be on this journey. And everyone, I believe, have individuals that will reach out to them and say, hey, can I help you? The first thing, just intuitive of who you are, you're going to say no. But you're doing yourself a disservice and not allowing your friends to be your friends if you don't take them up on that help. And that's the first thing that I had to learn. The second one was, and maybe even this is a part of, I would say, 1.1, and that is getting mental help. Because I was active duty, because I'm the oldest of 5 children, I have always been the sturdy one. I'm the leader. If the leader goes down, everyone else is going to collapse, right?
Yes.
So to me, by going or admitting that I needed help was failing the team. But because my husband and my supervisor at the time did that intervention that directed me to go to counseling was the point that I realized that sometimes when you go through this journey, the journey may not be for you, but for other people as well. Because I always felt that, so I did not, with my first cancer, I did not see myself as a breast cancer survivor. Because I didn't go through chemo or
the traditional way.
I didn't go through chemo or radiation. So I never associated myself with being a breast cancer survivor. So anything relative to breast cancer, I was always shying away. But I think my husband and my supervisor realized that she's not dealing with some things. And by me going to counseling, that was the best decision that was forced upon me. I can definitely say, because it helped me become in tune with myself, but also I had a chance to talk to other breast cancer survivors. And prior to that, I never talked to a breast cancer survivor.
Right.
That was my first time. I didn't know anyone. So I never even gravitated. I didn't go to any support groups. I didn't go to any walks or anything like that prior to that. And even, a little bit afterwards. It wasn't until I actually went to therapy.
So now that we've reached the subject of awareness and how important it is to for people around you to know what is going on with you, why it is important to support you mentally. And also you mentioned someone named Miss Sally in your talk, where you say that she comes and asks you this really insensitive question. I feel this really, really insensitive question. And so I want to ask you, how important do you think it is that we make people more aware about cancer, not just breast cancer, but all forms of cancer?
And you're right, it's because cancer, when you hear the word cancer, you will always get the same result. If it's prostate cancer, lung cancer, any type bone cancer, the first thing you're going to come to mind is that it's a death sentence, first of all. So understanding and being aware that technology and medicine has transformed immensely and is constantly transforming, that it is not a death sentence. You have metastatic breast cancer, you have triple negative breast cancer. These women, prior to this newer technology, were only living six months to a year. Now they're living 10 years plus with metastatic breast cancer and triple negative. So it's not a death sentence. It's a death sentence if you take it and not look at it that this is, and a lot of times it's an opportunity, because I don't see things in a negative perspective, as just as my TED talk is from tragedy to triumph. I've seen these opportunities as my triumph, in that once we are aware of things, once we know what a thing is, we can call it what it is. And the more that we talk about it, because I don't know about where you are, but in our community, in the African American community, we don't talk about such things. These are the things that you talk about, not even with family members. A lot of time we suffer in silence because we are so geared, we are so programmed to not talk about things. We don't talk about the boobs, we don't talk about the hair, we don't talk about the other things that is a part of that goes on behind the scenes. And that's one of the reasons why I wrote the book, What to Expect When You Wasn't Expecting Breast Cancer, because there's so many things that we don't talk about and that we don't see. So the awareness is, the more that you talk about it, the more that people see that, oh, wow, that person had breast cancer, look at them. And what will happen is people will then start coming to you because you've gone through this journey, and now you are on the other side of it, and you can talk about it, and you talk it from the first person perspective because you've lived it. And the more that we talk about it, the more individuals now are able to look and even go to the TED Talk and see, okay, this particular person has gone through it not once, but twice, but look how they're doing as a result of that. And that's where the awareness comes in. That's where the identity comes in. That's where a lot of times, as I mentioned earlier, we see ourselves in a certain light. This takes the mystery out of it.
So what you just said, it reminds me of another great African-American author, Ta-Nehisi Coates, in his book, Between the World and Me, which is just a tremendous piece of work that I only read last year. He says, my only work is to tell you about the path that I have walked so that you may learn from it what you can and walk your own.
And walk your own. Absolutely. Absolutely. And that's what it is. It's understanding, knowing, so that at least you'll have the tools and the knowledge to be able to walk the walk that you're supposed to walk. Absolutely.
So actually you answered a lot of my questions when you answered this. I wanted to ask you about the book. I wanted to ask you about the technology and how it has helped breast cancer, but I think we covered most of it.
Awesome.
So what I want to talk about now is early diagnosis and treatment and access to healthcare, access to the investigations required. Like you said, even so MRI is very difficult to come by in a country like India, and the public health service is so overloaded that even scheduling an MRI could take months. Like if I register for an MRI now, I could only get my MRI done at a government facility after months. So and what happens if that MRI scan, like in your case, comes inconclusive, right? So how important do you think is access to healthcare and early diagnosis?
Let me tell you, it's not only access, but I also talk about navigating. It's here in the United States, 90% of the people, well, maybe not that many, just are really, most people have some form of health insurance or health care. For me, access was not an issue. And for a number of the people that I know, access is not the issue, because I can schedule today. I can call my doctor on during the week. Maybe by the end of the week, I can probably have a mammogram. It's just that easy. Some individuals, are you able to get it that day because we don't have we don't have the same type of system that you all have. We have a government system, but most people have their own health care, their own health insurance, where you pay into, which gives you that access. Once you get that access, it's navigating through the system. And navigating, to me, is just as much as a problem as it is an access. And in a lot of cases, the access is calling up your doctor and making an appointment. Well, once you get there, now how do I navigate and get to all of these different either appointments or different other specialties that I need as a result of? Where do I go for chemo? Where do I go for radiation? Okay, this particular test was inconclusive. Now I have to wait for either a mailer to come in, or is my doctor going to call me with the results? And that's what happens in our case. So the doctors will call you if there's something that's either inconclusive, or if it comes out negative. They will call you versus just sending you a letter in the mail. And that's where I believe that we also need more legislation. We need more politicalness in ensuring that not only people have access, but they're able to navigate once they get into the system.
So is that what you meant when you say this on your website, that what you do is you open up doors so that other people may pass through it?
Yes, that so to me, and so that that door is also for a lot of African Americans. We did not have doors. So now creating a door, not only that gives you access, but even gives you the ability to navigate to these different other places that you need to go to so that you can get the care that you need. So absolutely, the doors are so important, because a lot of times we don't even know the doors that are even there to be able to gain the access to even be able to navigate through the system.
Could you tell me more about the foundation that you founded, the Breast Cancer
The
Move Foundation?
the Breast Cancer Move Foundation, and I always say that the optimum in that is move. Being able to get up and do what needs to be done so that you have that access, so that you have that you're able to navigate, but then other resources that you may need. For some, it may be transportation, because you may tell me I have this ability to use this program, but if I can't get there, then how can I access it and how can I navigate it? So we partner with Uber as well as Lyft, and to ensure that patients are able to get to their chemo, get to their radiation, and get to their appointments. Also, there are instances where individuals are unable to even pay for the co-pays for radiation, because here, depending on what type of insurance that you have, you think $30 wouldn't make a difference, but $30 for your copay, or even 75, you may not be able to afford. You may, because of your chemo or radiation, you may no longer be employed. So being able to pay for those copays are important. And just being able to know about other resources, other nonprofits, military organizations, the different legislation that is coming down from your state government is also important. And that's another thing. I'm on a couple of boards, and being a part of those boards, I'm now have an opportunity to make a difference politically on how access as well as medical makes a difference in ensuring that individuals have the things that they need to be successful.
I think with your identity, you stand in this intersection of Venn diagrams where you have to where you look at problems that rise because of race, they arise because of politics, they arise because of uh, discrimination and uh, everything, I feel. And how has it been navigating through all of this, and with your personal experience, with your own personal experience as a two-time breast cancer survivor?
It's been great. I I love doing this. And for me, it's not work. And the reason is because I love it. Anything that you love and anything that you truly believe in is not work. So being able to navigate, make those relationships, gain those alliances, really homes in and just really makes it even more concrete, so that when someone calls you and say, hey, I need some assistance with ensuring that my mom is getting the right type of care that she needs. If she's getting is this the right diagnosis? What does this mean?
Hello and welcome. My name is Tanja Thompson. I'm a two-time breast cancer survivor. I'm a 25-year Air Force military veteran, as well as a patient advocate. I want to thank Dr. Ph.D. for giving me this wonderful opportunity to talk to you and just have that dialogue about one cancer and how you, as young doctors, can really elevate yourself so that you are truly in tune and aware of some of the things that as breast cancer survivors that we may be having to deal with. So a part of the bigger conversation that Dr. Pethy and I were having had to do with the intersection of me as the individual as it relates to the Venn diagram. As you know, in a Venn diagram, there's usually the center. That's me, Tanja Thompson, and everything that encompasses it around on what I do and how I leverage myself to be that person, to be that conduit, to align, to focus, and to bring together different entities as well as different cultures to make it a holistic, a humanistic experience, not only for the health professional, but as well as for the patient as well. And some of the things that we talked about in that discussion, it related to politics, how politics play into the bigger role in healthcare. For an example, when I was going through chemo and radiation, I had a copay. As small as it may seem, $75 or maybe even $30. But what happens is, as you as a patient, you lose your job. You no longer have the ability to pay that $30 or that $75 because you may have other expenses that you may need to use to you just may not have it. So as a patient advocate, as well as someone who has a nonprofit, and that nonprofit is the Breast Cancer Move Foundation, where the optimum piece of that is move. I align the patient with resources so that they can hopes to find the tools that they need so that they can get the needs, so that their needs can be met. But think about as a health professional, one of the things that we don't like to talk about, and no one does, and that is how does ethnicity, culture, race, discrimination, social trauma, all of those things come into play is you as a doctor and me as a patient being heard. So that when I'm talking about a story or how I feel about something, you as a doctor, you can dig deep and ask some of those very open-ended and prevailing questions to get a better understanding of what does this patient actually mean. Where's the gap? What is it that they're saying, but also what they are not saying? Also, as a activist, as well as a patient advocate, I'm on a number of boards, and on those boards is a breast cancer board or a cancer board. There's a veteran board, but even a health commission board. And by having that political savviness, I am now speaking to my senators as well as congressmen as well as delegates on how does legislation as it relates to access to care, navigation to care, because we talk about how if we give you access. Okay, so think about this. If you give me access to care, so that means that I can walk into a building, but what happens if I don't know how to navigate how to get to the things, get to chemotherapy, radiology, the lab? How about if I don't even know what those things mean? And one of the examples that I mentioned to Dr. Pevy, and that was my husband and I took a trip to Dubai a couple of years ago. We had access, but we needed to know the rules before we went to Dubai so that we could effectively navigate the system so that we had a good experience. Or there were individuals along the way that we could have that conversation with, that we could have that dialogue with, that we felt comfortable that they would give us the correct and right information. So as you move forward in your journey as being doctors, think about this. And this is what my grandmother told me. She says, Tanja, you have 2 ears and 1 mouth. Learn to use them with it. Learn to use them in proportion. So as you're sitting there with a patient, just take a moment. Just like that. Lean in and really tune in and listen to what they have to say. Again, this is Tanja Thompson, 2-time breast cancer survivor, patient advocate, and retired Air Force military veteran. Hope to see you soon.